The surgical simulation lab was empty at 5:47 in the morning, except for the steady hum of fluorescent lights and the rhythmic movements of Dr. Elena Vasquez's hands. She stood at the training station, fingers moving through synthetic tissue with the kind of precision that came from somewhere deeper than medical school. Her dark hair was pulled back in a tight bun, and her eyes never left the practice incision she was closing with interrupted mattress sutures. She didn't hear Dr. Richard Brennan enter. The chief of cardiothoracic surgery had a way of moving through Metropolitan Medical Center like he owned every square inch of it, which in a sense, he did. For 30 years, his name had been synonymous with surgical excellence. His hair was perfectly silver, his white coat immaculate even at this ungodly hour, and his gold-rimmed glasses caught the light as he paused in the doorway. "You're here early for a first year." His voice cut through the silence like a scalpel through skin, hoping extra practice will make up for lack of natural talent. Elena's hands didn't falter. She completed the stitch she was working on, tied it off with practiced efficiency, and only then looked up. "Just preparing, Dr. Brennan." Her voice was soft, almost deferential, but there was something in her posture that didn't quite match the submissiveness of her words. Her spine was too straight, her shoulders too squared. Brennan walked closer, watching her hands move through the next suture. His eyes narrowed slightly. "You're using military-style interrupted mattress technique. That's not what we teach here." Elena's fingers paused for perhaps half a second, then continued their work. "I study various approaches, sir. Different techniques for different situations." Brennan picked up her file from the nearby desk, flipping through pages he'd already read 3 times since approving her residency application 6 weeks ago. "Stanford undergraduate. Top of your class. Excellent recommendations." He looked up at her, and there was something calculating in his gaze. "Everything looks perfect on paper, Dr. Vasquez. We'll see how you handle actual patients. I'm ready whenever you need me." Elena finished the final suture and stepped back from the training model. The incision was closed with geometric precision, each stitch exactly the same distance from the next. Brennan examined her work, his expression giving nothing away. "Report to OR prep at 7. You'll be observing today. First years observe. That's how we do things here." "Yes, sir." As Brennan turned to leave, Elena rolled down the sleeve of her scrubs, but not before he caught a glimpse of something dark on her right forearm. He paused at the door. "That tattoo." "What is it?" Elena's jaw tightened almost imperceptibly. "Personal? Dr. Brennan? Visible tattoos aren't exactly professional in a surgical residency." He didn't wait for a response, letting the door swing shut behind him. Elena stood alone in the simulation lab, staring at the closed door. Her right hand moved unconsciously to her left forearm, fingers tracing the outline of the caduceus, with wings that marked her as something other than what everyone here assumed she was. The sound of a helicopter passing overhead made her eyes close for 3 full seconds, and in that brief moment, she was somewhere else entirely. Somewhere with sand and blood, and the constant thunder of rotors that meant life or death. The locker room was starting to fill with residents when Elena arrived at 6:30. She changed quickly, keeping her eyes down, her movements economical. The other first years chattered nervously about the day ahead, but she remained silent, methodically checking her pockets for the essentials every resident carried. Penlight, notepad, pen, trauma shears. Well? Dr. Marcus Webb leaned against the lockers, his tall frame blocking her path. Still practicing basics? Some of us already graduated to real patients. His dark eyes held a mixture of amusement and something harder. Marcus was a 3rd-year resident, son of 2 famous cardiac surgeons, and he wore his pedigree like armor. Just being thorough. Elena moved to step around him. Thorough. Marcus laughed, and 2 other residents joined in. "You know what they call people who are too thorough in surgery? Slow. And slow gets people killed." Elena met his gaze for a moment, and something in her eyes made Marcus take a half step back before he caught himself. "I'll keep that in mind." In the scrub room adjacent to operating room 3, Nurse Patricia O'Connor was doing her morning inventory. At 52, Pat had seen more surgeries than most attendings would perform in their entire careers. Her red-gray hair was pulled back in a practical bun, and her hands moved with the automatic efficiency of 28 years in cardiac surgery. She'd been a nurse in the Gulf War before transitioning to civilian medicine, and she had little patience for incompetence or ego. She looked up when Elena entered to begin her pre-surgical scrub, even though, as an observer, it wasn't strictly necessary. The younger woman's movements caught her attention immediately. The way she positioned herself at the sink, the angle of her elbows, the methodical progression from fingertips to forearms. Pat had seen that exact technique before, in field hospitals where every motion had to be perfect because there was no backup, no second chance. "First day observing?" Pat asked, her Irish accent still strong after 3 decades in America. "Yes, ma'am." Elena kept her eyes on her hands, counting the strokes automatically. "You can drop the ma'am. This isn't the military." Pat watched the younger woman's shoulders stiffen slightly. Or is it? Elena looked up then, her dark eyes meeting Pat's green ones. "I'm just a resident, Nurse O'Connor." Pat moved closer, drying her hands on a sterile towel. "That tattoo on your arm. When you reached for the soap, your sleeve moved." She kept her voice low, aware that other staff were moving in and out of the scrub room. "Medical Corps insignia. Combat variant. I had one almost exactly like it before I had it removed." The water ran over Elena's hands, and for a moment she didn't respond. Then quietly, "You're mistaken." "Am I?" Pat studied her face. "Because those sutures you were doing in the simulation lab this morning, I saw them through the window when I came in early. That's not civilian technique. That's what you use when you're working on someone in the back of a Humvee and the road is so rough you can barely keep your footing." Elena shut off the water and reached for a towel. "With respect, Nurse O'Connor, I need to get to the OR." Pat nodded slowly. "Fair enough. But if you ever want to talk, my office is on the 3rd floor. Sometimes it helps, talking to someone who's been there." The words hung in the air between them, heavy with shared understanding that neither could fully acknowledge. Elena gave the briefest nod and pushed through the doors into the operating room, where Dr. Brennan was already positioned, examining X-rays on the light board. Dr. Vasquez, you'll stand there." Brennan pointed to a spot well back from the table, where she'd have a view but be completely out of the way. "Today you'll observe a routine valve replacement. Pay attention to every step. One day, if you prove yourself, you might be allowed to hold a retractor. If you want to see how this underestimated first-year resident shocks the entire surgical department, make sure you subscribe to Emergency Heroes Stories. Because what happens in the next 12 hours will change everything anyone thought they knew about Elena Vasquez. Where are you watching from? Drop a comment below because this story is just getting started." The residence lounge at 10:15 a.m. was a study in exhausted ambition. 4 first years and 2 second years sprawled across worn couches, surgical masks hanging around their necks, coffee cups in various stages of emptiness scattered across the table. Marcus Webb sat with his back against the armrest, holding court as usual. Did you see her face when Brennan told her she'd be observing for at least 6 months? He laughed, shaking his head. She looked like she wanted to argue but didn't have the guts. "Who?" "Vasquez." A second-year resident named Jennifer Park glanced toward the door as if Elena might walk in. "She's too quiet. I've barely heard her say 10 words since orientation." "That's because she's probably been up all night memorizing surgical videos." Marcus took a long sip of coffee. "Textbook smart doesn't mean anything in an OR. When the pressure hits, she'll freeze like everyone else does their first time." "I don't know." Another first year, David Chen, looked thoughtful. "Did you see her in simulation yesterday? Her suturing speed was insane. I've never seen anyone close an incision that fast. YouTube tutorials can teach you speed." Marcus dismissed the observation with a wave. "Doesn't mean she can handle a real patient, real blood, real consequences. Those sutures weren't just fast." Jennifer leaned forward. "They were perfect. Every single one identical. That's not something you get from videos. That's muscle memory. Hundreds of repetitions. Maybe she practiced on cadavers at Stanford." Marcus stood, stretching. "Either way, Brennan won't let her touch anything important for months. First years observe. That's the hierarchy." In his office on the 5th floor, Dr. Brennan sat across from Pat O'Connor, her personnel file open on his desk, though he wasn't really looking at it. The morning sun slanted through the blinds, casting shadows across his face. You wanted to see me, Doctor? Brennan? He removed his glasses, cleaning them with a small cloth from his pocket. Dr. Vasquez, what's your read on her? Pat considered the question carefully. She's competent. Very competent. More than any first year I've seen in 28 years here. That's not what I asked. Brennan replaced his glasses, his sharp blue eyes focusing on her. You were watching her in the scrub room this morning like you recognized something. I did. Pat folded her hands in her lap. That tattoo on her forearm. Medical Corps insignia. Combat variant. And her technique, the way she moves, the way she positions herself. That's military training. Her file says Stanford Medical School. Top 5% of her class. Nothing about military service. Brennan flipped through the pages again, as if expecting new information to materialize. Maybe she didn't list it. Maybe it was before medical school. Pat paused. Or maybe it was instead of traditional residency. The military runs accelerated programs in combat zones, field hospitals where you learn fast, or people die. That would make her what? A veteran pretending to be a first year. Brennan's tone was skeptical. Why would anyone do that? I don't know, but I know what I saw. Those aren't civilian hands, Dr. Brennan. Before he could respond, his pager went off. He glanced at it, then stood. We have a case. Harold Chen, 67, aortic valve stenosis. Elective replacement, routine procedure. Webb will operate under my supervision. And Vasquez? Observing. Like I said, first years observe. Brennan headed for the door, then paused. But keep watching her, Pat. If there's something she's hiding, I want to know what it is. At 11:23 a.m. on a Tuesday morning, Operating Room 3 was a controlled environment of steel and sterile precision. Harold Chen lay unconscious on the table, his chest prepped and draped, monitors displaying steady vital signs. Doctor. Brennan stood at the head of the table with Marcus positioned for the primary incision. 2 surgical nurses flanked them, instruments ready. Pat monitored the equipment. And Elena stood in her designated corner, far enough back to be out of the way, close enough to see everything. Scalpel. Marcus's hand was steady as he made the initial incision, following the guidance Brennan provided in low, measured tones. Blood pressure is 142/88. Heart rate holding at 76. Everything nominal. Elena watched the monitors more than the incision. Her dark eyes moved between the EKG readout, the oxygen saturation levels, the arterial pressure waveform. Something about the rhythm bothered her. The ST segments weren't quite right. There was an irregularity buried in what looked like normal sinus rhythm, something subtle that the monitoring software wasn't flagging because the overall pattern fell within acceptable parameters. Dr. Brennan. Her voice was quiet but clear. The EKG pattern. The ST segment elevation in leads 2, 3, and AVF. That's not just stenosis. There's underlying fibrillation. Brennan didn't look up from the surgical field. Vitals are stable, Dr. Vasquez. We proceed as planned. With respect, sir, if we open without preparing for rhythm conversion, when the heart is manipulated during valve exposure, that underlying instability could trigger ventricular fibrillation. Elena took a half step forward, then caught herself. We should have antiarrhythmics ready and internal paddles on standby. Now Brennan did look up, his eyes cold above his surgical mask. I've performed over 800 of these procedures. You've observed exactly 0. The vitals are stable. We proceed. But the calcification pattern on the imaging suggests, Elena started. Dr. Vasquez. Brennan's voice cut like a blade. You are here to observe and learn, not to question. If you cannot do that, you can leave. Elena's hands clenched once at her sides, then relaxed. Yes, sir. She stepped back to her corner. Marcus resumed the procedure, his confidence growing as Brennan guided him through each step. Pat glanced at Elena, saw the younger woman's eyes locked on the monitors, her jaw tight. The nurse had seen that look before, on the faces of medics who knew something was about to go wrong but couldn't stop it. Retractor. Marcus placed the instrument, exposing the surgical field. We're ready for the sternal saw. Proceed. Brennan watched critically as Marcus made the cuts, spreading the ribs to access the heart itself. Beautiful work, Dr. Webb. Clean. Precise. This is how it's done. The monitors continued their steady beeping. Harold Chen's heart beat with mechanical regularity, unaware of the hands preparing to stop it, repair it, restart it. Marcus reached for the next instrument. And then, exactly as Elena had predicted, everything went wrong. The monitor's steady beeping transformed into a shrill, continuous alarm. The EKG trace on the screen dissolved from organized rhythm into the chaotic, disorganized waves of ventricular fibrillation. Harold Chen's heart, exposed in the surgical field, began to quiver uselessly instead of pumping blood. V-fib. Pat's voice cut through the sudden chaos. Blood pressure dropping. 90/60. 80/55. Marcus froze, his hands suspended above the open chest, his face going pale above his surgical mask. Dr. Brennan, what should I... Step back, Webb. Brennan moved into position, his voice sharp and controlled. External paddles. Now. Get me 200 joules ready. Elena didn't ask permission. She simply moved forward, her body shifting from observer to operator in a single fluid motion. Her hands went to the instrument tray, selecting what she needed without hesitation. Dr. Brennan, external defibrillation won't work. The chest is already open. We need internal cardioversion. Now. Brennan's hands hovered over the surgical field for perhaps 2 seconds, his mind calculating risks, protocols, the fact that a first-year resident was telling him how to save his patient. Then his training overrode his ego. Do it. Elena's movements were like watching a different person emerge from inside the quiet, deferential resident who had stood in the corner. Her hands moved with absolute certainty. Scalpel. She extended the incision Marcus had made, her fingers working with practiced speed, extending to fourth intercostal space for better access. Internal paddles. Pat handed them over, her eyes wide but her movements automatic, charging to 10 joules. Elena positioned the paddles on either side of the quivering heart. Clear. The first shock made Chen's body jerk slightly. The EKG trace remained chaotic, still in V-fib. Brennan's voice was tight. Blood pressure 70/45. Amiodarone, 150 milligrams IV push. Elena's voice was calm, almost detached, as if she'd done this 1,000 times before. Which, Pat was beginning to suspect, she had. The medication went in. Elena recharged the paddles. 20 joules this time. Clear. The second shock rippled through Harold Chen's exposed heart. For 3 seconds that felt like 3 hours. Nothing changed. Then the monitor caught a single organized beat. Then another. Rhythm converting. Pat's voice held something like awe. Sinus rhythm establishing. There. Elena's hands moved to suction, clearing blood from the surgical field. I can see the valve clearly now. She paused, examining what the fibrillation crisis had revealed. Dr. Brennan, the calcification is worse than the imaging showed. See here and here. The deposits extend into the annulus. We need aggressive debridement before we can place the replacement valve, or it won't seat properly. Her fingers moved like a concert pianist performing a complex piece from memory, each motion precise and purposeful. She began the debridement without waiting for approval, removing calcified tissue with careful, deliberate strokes. Too aggressive, and she'd damage healthy tissue. Too cautious, and the new valve wouldn't function properly. Marcus stood back, transfixed. Jennifer Park, who'd been called in to assist, stared at Elena's hands. Even Brennan found himself simply watching, his role shifting from primary surgeon to witness. Small Richardson. Elena's hand extended, and the retractor appeared in it instantly. Now I need better visualization. Suction here. The anesthesiologist called out from his station. Heart rate stabilizing at 78. Blood pressure rising. 95/60. 105/65. Elena worked in silence for the next 40 minutes, her hands moving through tissue with the kind of confidence that came from experience far beyond her supposed training. She debrided the calcification, prepared the valve seat, positioned the replacement valve, and began suturing it into place with interrupted stitches that were absolutely identical, each one placed with geometric precision. Proline suture, 2-0. Her voice was soft, almost meditative. Each stitch needs to be exactly the same tension. Too tight and you'll tear the tissue. Too loose and you'll get regurgitation. She placed 12 sutures in 8 minutes. Each one perfect. Test the valve. Elena stepped back slightly, allowing Brennan to examine her work. He did, checking every aspect with clinical precision. No regurgitation. Perfect seating. Excellent hemostasis. His voice was quiet, professional. But there was something else beneath it. Something like recognition. Closing the pericardium. Elena had already moved to the next step. Running stitch, 3-nil Vicryl. Her hands flew through the closing procedure. Layers of tissue brought together with practiced efficiency. The kind of efficiency you didn't learn in simulation labs or from surgical videos. The kind that came from doing this in circumstances where speed mattered, where every second counted because there was another wounded patient waiting, and another after that. The clock on the wall showed 2:14 p.m. From the moment of ventricular fibrillation to complete valve replacement and closure had taken 87 minutes. A procedure that typically required 3 hours minimum. Brennan checked his watch, then looked at the monitors. All vitals stable. Heart rhythm perfect. He turned to Elena, who was removing her blood-stained gloves. "Where did you learn that technique, Dr. Vasquez?" Elena met his gaze steadily. "Training, sir." She dropped the gloves in the disposal bin. "I can scrub in for the 3 p.m. case if you need me." She walked out of the OR before anyone could respond, leaving behind a room full of people who were all thinking the same thing. That wasn't a first-year resident. That was someone with years of high-pressure surgical experience. The question was, where had she gotten it? And why was she pretending to be something she wasn't? Pat followed Elena into the scrub room, where the younger woman stood at the sink, methodically washing her hands with more force than necessary. Her shoulders were rigid, her breathing controlled but slightly elevated. That was incredible, Pat said quietly. Elena didn't look up. "I did what needed to be done. You saved his life." Pat moved closer. Brennan would have gone external defibrillation. By the time he realized it wasn't working and switched to internal paddles, Chen would have been brain dead. Now Elena did look up, and Pat saw something in her eyes that made her catch her breath. Exhaustion. Old pain. The weight of too many impossible decisions. "I just want to help people, Nurse O'Connor. That's all. Can I do that without everyone questioning everything?" Before Pat could answer, the OR doors burst open and Marcus Webb emerged, his face a mixture of shock and something else. Something that looked like the first stirrings of respect. "How did you?" he started, then stopped. "I've been training for 3 years. I couldn't have done what you just did." Elena dried her hands carefully, precisely. "You would have figured it out. Dr. Brennan was right there to guide you." "No," Marcus shook his head. "He was about to do external defibrillation. You knew instantly what was needed. That kind of decision-making doesn't come from books." Elena pulled her surgical cap off, her long dark hair falling around her shoulders. "I study hard, Dr. Webb. Now if you'll excuse me, I need to get ready for the next case." She left him standing there, staring after her, wondering who Elena Vasquez really was. The residence lounge at 3:45 p.m. was thick with tension and whispered speculation. 6 residents clustered around the coffee maker, their voices low but urgent. Word had spread through the surgical department faster than a code blue announcement. The first year who nobody knew had just performed an internal cardioversion and a complicated valve replacement while the chief of cardiothoracic surgery watched. "I'm telling you, that wasn't luck." Jennifer Park set her coffee down hard enough to slosh liquid onto the table. "I was in there. I handed her instruments. She didn't hesitate once. Not once. Every movement was exactly right." Marcus sat in the corner, unusually quiet. He'd been replaying the surgery in his mind for the past hour, trying to reconcile what he'd witnessed with everything he thought he knew about surgical training. "Maybe she's just really good at staying calm under pressure," David Chen offered, though his tone suggested he didn't believe his own explanation. "Nobody learns to suture like that from staying calm." Jennifer shook her head. "Those interrupted mattress stitches. 12 of them, each one identical. That's not talent. That's hundreds, maybe thousands of repetitions. She had to have trained somewhere else." Another second-year resident, Michael Torres leaned forward. Stanford doesn't teach that kind of speed. I did a rotation there. Their residents are good, but they're methodical. Slow and perfect. Not fast and perfect. Marcus finally spoke up. She predicted the V-fib before it happened. Called it out based on EKG patterns I couldn't even see. Brennan dismissed her. And then 30 seconds later, exactly what she said would happen did happen. So what are you saying? David asked. That she's some kind of surgical prodigy who decided to hide her abilities? I'm saying she's had training none of us have. Marcus stood, walking to the window. And I want to know where. In his office, Dr. Brennan sat across from Pat O'Connor for the second time that day. The afternoon sun cast long shadows across his desk, and his expression was troubled in a way that Pat had rarely seen in 30 years of working with him. You were right, he said without preamble, about the military training. Pat waited, knowing he had more to say. That internal cardioversion technique. Brennan removed his glasses, rubbing the bridge of his nose. I've seen it before once, at a trauma conference. A military surgeon from a forward surgical team demonstrated it. Said it was standard protocol in combat zones where you don't have the luxury of time or proper equipment. And the way she moved, Pat added, like she'd done it under pressure before. Real pressure, not simulation pressure. She's 29 years old. Brennan put his glasses back on. If she went straight through medical school, graduated at what, 25 or 26? That's not enough time to get that kind of experience in civilian medicine. Unless it wasn't civilian medicine. Pat folded her hands in her lap. Unless she did military residency, accelerated program in a combat zone. 3 years instead of 5 or 6, but with trauma volume that most surgeons don't see in a lifetime. Before Brennan could respond, the overhead speaker crackled to life, and both of them froze at the words that followed. Trauma Alert Level 1. Mass Casualty Incident. Highway collision involving military convoy. Multiple critical casualties inbound. ETA 8 minutes. All available surgical staff report to emergency department immediately. This is not a drill. Repeat. Trauma Alert Level 1. Brennan was on his feet before the announcement finished. Let's go. The emergency department transformed into controlled chaos within 60 seconds. Trauma bays were cleared and prepped. Surgical teams assembled. Equipment rolled into position. The attending physicians coordinated, voices sharp and efficient, preparing for the unknown variables of mass trauma. Elena emerged from the stairwell at a run, still in her surgical scrubs from the valve replacement. She paused just inside the ED, her eyes sweeping the scene with the kind of automatic assessment that came from muscle memory. 5 bays being prepped. 2 trauma teams. 1 cardiothoracic team. Not enough for what was coming. She could hear it in the radio traffic. See it in the way the charge nurse was biting her lip. The radio on the wall crackled with updates from the ambulances. Primary transport, this is Medic 7. We have 5 critical patients. 2 were code blue in transit. Successful resuscitation but unstable. 3 with penetrating chest trauma from secondary explosions. Military transport truck T-boned by semi-truck at the intersection of 5th and Madison. Ammunition in the truck bed cooked off from the impact fire. Requesting all available trauma surgeons, cardiothoracic specialty preferred. Brennan strode in, Marcus and 2 other residents behind him. He began assigning positions immediately. Webb, you take Bay 1. Richardson, Bay 2. Torres, Bay 3. His eyes landed on Elena. Vasquez, you're observing in Bay 5, least critical patient. Elena opened her mouth as if to argue, then closed it. Yes, sir. The first ambulance arrived at 4:17 p.m. exactly. The bay doors crashed open and paramedics rushed in, wheeling a gurney carrying a young sergeant, maybe 23, his uniform torn and bloody. The paramedic at the head of the gurney was calling out vitals when he saw Elena. He stopped so abruptly that the other paramedic almost ran into him. His eyes went wide behind his blood-spattered face shield. Wait. His voice was hoarse from smoke inhalation. Dr. Vasquez? Major Vasquez? Elena felt her stomach drop. She knew that voice. Specialist Greg Morrison, who'd been a combat medic in Kandahar. She'd trained him herself, worked alongside him in conditions that still haunted her dreams. You're mistaken. Her voice was steady, but her hands clenched at her sides. I'm just a resident here. But you? Morrison looked confused, his exhaustion making it hard to process the disconnect between what he was seeing and what he knew. Kandahar, 2021. You saved half my platoon when our convoy got hit. You're the one who taught me how to do chest decompressions under fire. Wrong person. Elena stepped forward, her professional mask firmly in place. Where's your patient? What are his injuries? Morrison stared at her for another second, then shook his head as if trying to clear it. Maybe I'm more rattled than I thought. He refocused on his patient. Sergeant David Park. Penetrating chest trauma. Possible pneumothorax. Pat O'Connor stood 10 feet away, inventory clipboard forgotten in her hands. She'd heard every word. Watched Elena's face go carefully blank. Seen the recognition in the paramedics' eyes. Bay 5. Elena directed them, following the gurney. Let's get him stabilized. The second and third ambulances arrived in quick succession. The ED filled with controlled urgency, the sound of multiple traumas being assessed simultaneously. Marcus in Bay 1 was dealing with abdominal trauma. Bay 2 had a head injury. Bay 3 had compound fractures. And in Bay 5, Elena examined the sergeant who was supposed to be her least critical case. She placed her stethoscope on his chest, listened, moved it to another position, listened again. Her face went very still. Respiratory rate 28. Decreased breath sounds on the left side. Tracheal deviation. She looked up at the trauma attending, Dr. Sarah Kim. This isn't minor chest contusion. This is tension pneumothorax. He's got maybe 3 minutes before his heart stops. Dr. Kim moved to confirm, her stethoscope already out. You're right. She looked around for a chest tube kit. We need to decompress now. I need a chest tube kit in Bay 5. Elena raised her voice to be heard over the organized chaos. Now! A nurse hesitated. Dr. Vasquez, you need attending authorization for invasive procedures. He'll be dead in 3 minutes. Elena's voice cut through the noise like a scalpel. Kit. Now. Pat appeared at her elbow, the kit already in her hands. Do it, doctor. Their eyes met for a fraction of a second, understanding passing between them. Then Elena's training took over completely. Elena's hands moved with absolute certainty. 5th intercostal space, mid-axillary line. She palpated the landmarks through the torn uniform, finding her position by touch. Betadine. Pat swabbed the area in 3 quick strokes. The sergeant's breathing was getting more labored, his lips beginning to show a faint blue tinge. His oxygen saturation was dropping on the monitor. 89%. 86%. Needle decompression first. Elena took the large bore catheter from the kit. This will relieve the immediate pressure. She inserted the needle at a precise angle, and the hiss of escaping air confirmed her diagnosis. The sergeant took a shuddering breath, his color already beginning to improve slightly. But that's temporary. Elena was already prepping for the chest tube. We need definitive treatment. Scalpel. She made a small incision, then used blunt dissection to create a tract through the intercostal muscles. Her fingers worked with practiced efficiency, feeling for the pleural space. There. Chest tube. The tube slid in smoothly, and more air rushed out, followed by some bloody fluid. The sergeant's oxygen saturation began climbing. 88. 91. 94. Secure it. Elena stepped back, allowing the nurse to suture the tube in place. Dr. Kim, he's going to need a chest x-ray to confirm placement, but he's stable now. Doctor. Kim was staring at her with an expression that mixed professional appreciation with deep confusion. That was textbook battlefield procedure. Where did you learn that? Before Elena could answer, a shout came from Bay 3. Code Blue! Patients crashing! Elena turned to see medical staff converging on Bay 3, where a soldier with penetrating chest trauma was deteriorating rapidly. The monitors showed blood pressure plummeting, heart rate climbing into dangerous tachycardia, pericardial tamponade. The attending physician, Dr. James Morrison, was a skilled trauma surgeon, but his face showed the strain of dealing with an injury he'd only seen in textbooks. We're losing him. Brennan was still in Bay 1 with Marcus, elbow deep in an abdominal repair that couldn't be abandoned. Dr. Morrison looked around frantically for help that wasn't coming fast enough. Elena stood frozen for 3 seconds, torn between two worlds. Her carefully constructed new identity, her chance to leave the past behind, her desire to just be a normal resident learning civilian medicine. And then there was the soldier dying 30 feet away. Pat saw the war playing out on Elena's face. "Go," the older nurse said quietly. "He needs you." Elena moved. Not the careful, deferential walk of a first-year resident, but the purposeful stride of a combat surgeon who'd made life and death decisions in conditions that would break most people. She pushed through the crowd around Bay 3. The patient was a staff sergeant, maybe 30 years old, his chest rising and falling in rapid, shallow movements. The monitor showed all the classic signs: elevated central venous pressure, muffled heart sounds, distended neck veins, the Beck's triad of cardiac tamponade. Dr. Morrison looked up as Elena arrived. "Vasquez, you shouldn't be. We need someone with experience. I can do this." Elena's voice was steady, calm, absolutely certain. "Pericardiocentesis. I need a pericardiocentesis kit, ultrasound if we have it, or we go blind if we don't. You've never done one outside of simulation." Dr. Morrison was pulling on gloves, preparing to attempt the procedure himself. "I haven't either, not on a live patient. I've done 23. Elena said it quietly, but every person in the immediate vicinity heard. In field hospitals, under mortar fire, without ultrasound. This patient has maybe 4 minutes before his heart stops completely. Let me work." The authority in her voice, the absolute confidence, made Dr. Morrison step aside almost without realizing he was doing it. "Do it." Elena's hands moved to position the patient, prepping the subxiphoid approach. She closed her eyes for 2 seconds, visualizing the anatomy. "Pericardiocentesis kit." Pat handed it to her, their movements synchronized like they'd worked together for years instead of hours. Needle going in. Elena's voice was quiet, almost meditative. 45-degree angle, aimed at the left shoulder. She advanced the needle slowly, carefully, feeling for the resistance change that would tell her she'd entered the pericardial space. The room held its breath. The monitor showed the patient's blood pressure dropping further. 70/40. 65/35. There. Elena felt the needle penetrate the pericardium. Dark blood began flowing back through the syringe, evacuating fluid. She drew back 60 milliliters of blood-tinged fluid, and the effect was immediate. The patient's blood pressure began to rise. His heart, no longer compressed by accumulated fluid, could beat effectively again. Cardiac output restoring. The anesthesiologist watching the monitors called out. Blood pressure rising. 80/50. 90/55. Elena secured the catheter in place. He needs surgery to repair the cardiac injury, but he's stable enough for transport to the OR now. She looked up and saw Dr. Brennan standing at the edge of Bay 3. He'd left Marcus to close the abdominal case and had witnessed the entire procedure. His expression was unreadable behind his surgical mask, but his eyes were sharp, calculating. Before anyone could speak, the bay doors burst open again. The last ambulance had arrived, and the paramedics were moving fast, their faces grim. "Critical patient, multiple injuries including chest trauma. This is Colonel James Rodriguez, requesting immediate surgical intervention." The gurney rolled past, and Elena saw the patient clearly. Her breath caught in her throat. She knew that face. Had operated on him before, in a field hospital outside Kandahar. Had saved his life when an IED took out his convoy, and he'd been the only survivor because she'd refused to give up when everyone else said he was too far gone. Rodriguez was semi-conscious, his eyes tracking movement. When they landed on Elena, they focused with sudden clarity. Major Vasquez. His voice was weak but absolutely certain. "Best combat surgeon I ever saw. Saved my life. Kandahar, 2021. The emergency department didn't go completely silent. There were still too many active traumas being managed, but everyone within earshot stopped what they were doing. Pat, Dr. Morrison, the nurses, the residents who'd gathered to watch, and Dr. Brennan, who took 2 steps forward, his eyes moving from Rodriguez to Elena and back again. "Colonel." Elena's voice was steady, but something in her posture had changed. Like a weight she'd been carrying was finally about to be set down. We need to get you stabilized. You're here. Rodriguez tried to smile through his pain. Knew you. Got out. Made it home. Good. His monitor began alarming. Blood pressure dropping. 85/50. 75/45. He's decompensating. Dr. Morrison moved forward. Internal bleeding, probably from the chest trauma. We need to get him to OR immediately. He won't survive transport. Elena said it quietly, but with absolute certainty. Look at his pressure. He's bleeding into his chest cavity fast. Maybe a shifted shrapnel fragment from his previous injury. He needs an emergency thoracotomy here now. Brennan moved closer, his eyes never leaving Elena's face. Field thoracotomy. That's not a procedure we do in civilian emergency departments. I know. Elena met his gaze steadily, and in that moment, her carefully maintained facade finally cracked. But it's what he needs to survive. And I've done 23 of them. The moment stretched out, balanced on a knife's edge. Then Brennan gave a single sharp nod. Dr. Vasquez, he said formally. Show us what you can do. Elena stepped to the head of the bay, her entire demeanor transforming. The quiet, deferential first-year resident was gone, replaced by someone who carried the weight of command like a familiar coat. I need a thoracotomy tray. 2 units O-negative blood, and everyone not essential to this procedure needs to step back and give us room. The nurses moved instantly, responding to the authority in her voice. Pat wheeled over the equipment cart while another nurse ran for the blood. The residents who'd gathered to watch pressed against the walls, creating space. Rodriguez's blood pressure continued dropping. 65/40. His breathing was rapid and shallow, his skin taking on a grayish pallor. Major Elena Vasquez. She said it clearly, her voice carrying across the bay. MD, United States Army Medical Corps. 4 years active duty. 3 combat deployments. Afghanistan. Syria. Horn of Africa. The emergency department fell quieter, conversations stopping mid-sentence. Marcus Webb stood frozen in the entrance to Bay 1. Jennifer Park's hands stilled on the instrument tray she'd been organizing. Even the attending physicians turned to listen. Brennan's expression was unreadable. You lied on your application? Elena pulled on sterile gloves, her movements crisp and efficient. No, sir. I listed my medical experience. Stanford for undergraduate and medical school. Army Medical Corps for surgical residency. It was all there. You assumed Stanford was my only training. Military residency. Brennan's voice was tight. You completed a full cardiothoracic residency in the Army? 3 years forward surgical teams. Over 340 combat surgeries. Cardiac trauma, vascular repair, thoracic reconstruction under fire. Elena positioned herself at Rodriguez's left side. Betadine prep. No time for a full sterile field. A nurse swabbed the colonel's chest while Elena assessed the situation with clinical precision. BP 60/35 and falling. We're losing him. That's impossible. Marcus's voice came from across the room. You're 29 years old. That timeline doesn't work. Elena didn't look up. Entered medical school at 19. Graduated at 23. The Army accelerates surgical training in combat zones. You learn fast because people die if you don't. She picked up the scalpel. Are we going to debate my credentials, or are we going to save Colonel Rodriguez's life? Brennan moved closer, taking a position where he could observe. Proceed, Major Vasquez. The title felt strange and right at the same time. Elena took one breath to center herself, then began. Left anterolateral thoracotomy. 5th intercostal space. Her scalpel moved in a single smooth motion, opening skin and subcutaneous tissue. The incision was bold, confident, the kind you made when seconds mattered and hesitation could be fatal. Rib spreader. Pat handed it to her, and Elena positioned it quickly, cranking it open to expose the chest cavity. The ribs separated with a sound that made several observers wince, but Elena's face remained focused. Calm. Suction. Blood welled up from inside the chest, and she cleared it systematically. There. I can see the bleeding. Intercostal artery laceration, and... She paused, peering deeper. There. Shrapnel fragment against the left atrium. Old injury that shifted from the impact. From Kandahar. Rodriguez managed to whisper. Never got it. All out. Too deep. I remember. Elena's voice softened for just a moment. You told me to leave it. That you'd rather take your chances than have me dig around your heart in a field hospital. Looks like that decision just caught up to you. Can you remove it? Brennan asked quietly. I have to. If it stays there, it'll eventually pierce the atrium. But if I'm not careful removing it, it'll tear the tissue, and he'll bleed out in seconds. Elena extended her hand. Vascular clamps. I need to isolate the intercostal artery first. Her hands moved with absolute precision, placing clamps to control the arterial bleeding. The well of blood slowed, stopped, clamped. Now for the critical part. The fragment was barely visible, a dark metallic sliver pressed against the thin wall of the heart's left atrium. One wrong move, one slip, and it would tear through tissue that couldn't be easily repaired. The room was absolutely silent, except for the beeping of monitors and the hiss of the ventilator. Elena reached in with long forceps, her movements slow and deliberate. Her fingers, her hands, her entire body was still, focused on that single point of contact. She'd done this before, in conditions far worse than this, in a tent that shook with each explosion, with inadequate lighting and instruments that were clean but not sterile, with 3 other patients waiting and no backup coming. This, by comparison, was almost easy. The fragment shifted slightly as she gripped it. She paused, adjusted her angle, pulled with steady, even pressure. The metal slid free, and the atrial wall remained intact. Fragment out. Atrium intact. She dropped the shrapnel into a metal pan with a clink that sounded impossibly loud. Now suturing the intercostal artery. 5-0 Proline. Running stitch. Her fingers flew through the repair, each stitch placed with mechanical precision. The artery was small, delicate, and the tissue was damaged from the initial trauma. But Elena's hands knew exactly how much tension to apply, exactly where each needle had to pass. Arterial repair complete. She released the vascular clamp carefully. No bleeding. We're good. But even as she said it, Rodriguez's monitor began alarming. The steady beep of his heartbeat dissolved into the chaotic tone of ventricular fibrillation. Fib, Pat called out. He's arresting. Elena didn't hesitate. Internal cardiac massage. My hands are already in there. She positioned her left hand around Rodriguez's heart, feeling it quiver uselessly under her fingers. 1, 2, 3, 4. She compressed rhythmically, manually pumping blood through his body. 5, 6, 7, 8. Epi. 1 milligram V-push. She kept compressing, her voice steady despite the desperate nature of what she was doing. Come on, James. You survived an IED strike in Kandahar. You're not dying in a Chicago emergency room. The epinephrine went in. Elena continued the internal compressions. 30 seconds. 45. Her shoulder was beginning to burn from the awkward angle, but her rhythm never faltered. 1, 2, 3, 4. 90 seconds of internal cardiac massage. Marcus, watching from the doorway, had stopped breathing. Jennifer Park's hand was pressed against her mouth. Brennan stood absolutely still, his experienced eyes taking in every detail of the procedure. Then the monitor caught a single organized beat, then another. The chaotic tone resolved into the steady beep of normal sinus rhythm. Sinus rhythm. Pat's voice was tight with emotion. We have pulse, blood pressure rising, 90/60, 100/65. Rodriguez's eyes fluttered open, focusing on Elena with surprising clarity. Told them. Best surgeon I ever saw. Elena felt something crack open in her chest. Some wall she'd built to keep her military life separate from her civilian one. You're going to be fine, Colonel. But you're getting a full cardiac workup after this, and we're making absolutely sure there are no other souvenirs from Afghanistan hiding in there. She began closing the thoracotomy, her hands steady, despite the adrenaline that had to be flooding her system. Chest tube placement, then closing in layers. Brennan moved to the opposite side of the table, observing her closure technique with professional interest. That was extraordinary. His voice was quiet, meant only for her ears. In 30 years of cardiac surgery, I've never seen anything like that. The precision, the speed, the decision-making under that kind of pressure. Elena looked up, meeting his eyes across Rodriguez's chest. It's what I was trained for, Dr. Brennan, but it's also why I came here. I wanted to learn civilian medicine, to save people without having to choose who lives and who dies based on available resources, to work in an environment where we have time and equipment and backup. And yet you were willing to pretend to be a first year, to start over from the beginning. I needed to. Elena returned her attention to her sutures, because the person who did those 340 combat surgeries isn't who I want to be anymore. She's someone I left behind. Or tried to. The conference room on the 5th floor felt too small for the weight of the conversation happening inside it. Elena sat in a chair that seemed designed to be uncomfortable, still wearing scrubs that bore traces of Colonel Rodriguez's blood. The clock on the wall showed 8:43 p.m. It had been 4 hours since the mass casualty incident began, and all 5 critical patients were now stable, in surgery, or recovering. Across the polished table sat Dr. Brennan, Dr. Patricia Holloway, who chaired the hospital's surgery department, and 2 members of the medical board. The silence stretched for several seconds before Brennan finally spoke. Dr. Vasquez. He paused, then corrected himself. Major Vasquez. I owe you an apology. Elena's hands were folded in her lap, her posture straight despite her exhaustion. Sir, I understand if there are consequences for not being fully transparent about my background. Consequences? Dr. Holloway leaned forward, her sharp eyes studying Elena's face. You saved 5 lives today. One of them with a procedure I wouldn't have attempted, and I've been practicing trauma surgery for 20 years. The only consequence is that we severely underestimated you. We all did. Brennan removed his glasses, cleaning them with deliberate care. Your file showed military service, but nothing indicating the level of expertise you demonstrated today. The internal cardioversion this morning, the pericardiocentesis, the field thoracotomy. These aren't procedures you learn from textbooks. Elena met his gaze steadily. I didn't hide my military service. I listed Army Medical Corps, surgical residency completed in forward operating bases. It was all documented in my application, but I understand why you assumed it was supplementary training rather than primary. You let us think you were inexperienced. One of the board members, Dr. Robert Chen, tapped his pen against his notepad. Why? Why come here as a first year when you clearly have more practical experience than most of our senior residents? Elena was quiet for a moment, choosing her words carefully. Because I wanted to learn civilian medicine, not as an addition to military training, but as a different way of thinking. Combat surgery is about triage, about doing the most good with limited resources. It's about accepting that you can't save everyone and making peace with that. Her voice tightened slightly. I wanted to work in an environment where we don't have to make those choices, where we have time, equipment, backup, where every patient gets the care they need, not just the care we can provide in the moment. That's admirable. Dr. Holloway made a note on her tablet. But it doesn't explain why you were willing to start over, to be treated as someone with no experience. Because I wanted to be someone with no experience. Elena's hands tightened in her lap, the only visible sign of her emotional state. The person who did those 340 combat surgeries carries things I'd rather leave behind. What things? Brennan asked gently. Elena closed her eyes briefly. In Kandahar 2021, our field hospital was overrun during a major offensive. We had 17 critically wounded soldiers and limited blood supply. I had to choose. She opened her eyes, and the pain in them was raw. 3 soldiers died because I made the wrong choice about who got transfusions. The inquiry cleared me, said I followed proper triage protocols, but that doesn't change the fact that I chose wrong. The room was silent. Even Dr. Chen had stopped tapping his pen. I came here because I wanted to save everyone. Elena's voice was barely above a whisper. I wanted to work in a place where nobody has to die because we ran out of blood or time or options. I wanted to be a doctor who heals, not a soldier who triages. Brennan exchanged a glance with Dr. Holloway. Then you should know something. He pulled a folder from his briefcase and slid it across the table. Colonel Rodriguez asked me to give you this. He's been trying to reach you for 2 months, but you changed your contact information when you left the service. Elena opened the folder with trembling hands. Inside was a declassified Army investigation report, stamped with official seals and signatures. Her eyes scanned the pages, widening as she read. The blood supply issue at Kandahar wasn't random, Brennan said quietly. According to that investigation, which was only completed 6 months ago, the supply officer was stealing blood products and selling them on the black market. You were systematically shorted on every major trauma day for 3 months. The soldiers who died? They died because someone stole their chance at survival. Not because you made the wrong choice. Elena read through the document twice, her hands shaking. The words blurred together. Criminal charges filed. Court-martial proceedings. Guilty on all counts. Formal exoneration of Major Elena Vasquez, who acted with exemplary judgment under impossible circumstances deliberately created by supply chain corruption. She set the papers down carefully, as if they might shatter. Years of guilt, of second-guessing every decision, of wondering if she could have saved those 3 men if she'd just been better, faster, smarter. And all along, it wasn't her fault. It was sabotage. The room waited while she processed this. A tear tracked down her cheek, and she wiped it away almost angrily. Dr. Holloway spoke into the silence. We have a proposal for you. We want to offer you advanced standing in our residency program. Your combat experience counts as equivalent to 2 years of general surgery residency. We're placing you as a 3rd-year cardiac surgery resident, effective immediately. Elena looked up, surprised. I came here to learn from the beginning, and you've proven you don't need to learn the basics. Brennan's voice was firm, but not unkind. You need to learn how we apply those skills in a civilian context. You need to understand our protocols, our resources, our different kind of pressure. But we're not going to insult you by pretending you're a 1st year when you have more trauma experience than most of our attending physicians. Additionally, Dr. Holloway continued, we want you to develop a combat-to-civilian trauma protocol program. Teach what you know. Help us incorporate military field techniques that could save lives here. Too many excellent military medical professionals struggle to transition to civilian practice because we don't value their experience appropriately. Elena sat back, overwhelmed. I don't know what to say. Say yes. A new voice came from the doorway. Colonel Rodriguez stood there, leaning heavily on a walker, his chest wrapped in bandages, but his eyes clear and determined. Say yes, because what you know shouldn't be wasted. You saved my life twice, Major. Once in Kandahar and once today. How many other people could you save if you stopped hiding? Elena stood, professional courtesy overriding her emotional state. Colonel, you should be in recovery. I will be. Rodriguez moved slowly into the room. But first, I needed to make sure you got that report. And to tell you something I should have said 3 years ago. What happened in Kandahar wasn't your fault. It was never your fault. And it's time you stopped punishing yourself for someone else's crime. The words hit Elena like a physical blow. She'd been carrying that guilt for so long. It had become part of her identity. The surgeon who failed. The officer who made the wrong call. Letting it go felt dangerous, like losing a piece of herself. But maybe that was the point. Maybe that was exactly the piece she needed to lose. She turned back to Brennan and Dr. Holloway. I accept. The advanced standing and the program development. But I have 3 conditions. Dr. Holloway smiled slightly. Name them. 1. Any veteran who wants to transition to civilian medicine comes through this program. We train them properly, help them adapt, but we respect what they already know. 2. We establish veteran-specific support services. PTSD counseling, peer groups, transition assistance. Combat surgeons carry trauma that civilians don't fully understand. 3. This is a 2-way exchange. Military medical professionals teach us, and we teach them. We learn from each other. Brennan nodded slowly. Done. All 3. When can you start? Elena glanced at the clock. It's 9:15 p.m. I start tomorrow as a 3rd-year resident? You start now. Dr. Holloway stood, extending her hand. Welcome to the senior surgical staff, Dr. Vasquez. We're lucky to have you. 6 weeks later, Metropolitan Medical Center looked the same from the outside, but inside, everything had changed. The simulation lab on the 3rd floor was packed with residents on a cold December morning. 12 surgical residents, ranging from 1st to 3rd year, stood around training stations while Elena moved between them, observing, correcting, teaching. 6 weeks had transformed not just her role, but the entire culture of Metropolitan Medical Center's surgical program. Today we're covering emergency pericardiocentesis. Elena stood at the demonstration table, a training mannequin positioned before her. Civilian protocols emphasize ultrasound guidance, which is absolutely the gold standard when you have time and equipment. But combat medicine taught me that sometimes you have 60 seconds and no imaging. You need to know both approaches. A first-year resident, the same David Chen who'd defended Elena in the lounge weeks ago, raised his hand. Dr. Vasquez, what if we make a mistake going in blind? Elena's expression softened. You will make mistakes. I have. The question isn't if you'll make errors. It's how you prepare so thoroughly that errors become rare, and how you develop the judgment to know when to act despite the risk. She demonstrated the landmark technique on the mannequin. Sometimes the choice isn't between perfect execution and mistake. It's between attempting a difficult procedure or watching someone die. That's the reality of emergency medicine. She worked through the demonstration, her hands steady and sure, explaining each step with the clarity of someone who'd not only performed the procedure, but taught it under impossible conditions. The residents watched with an attention that went beyond academic interest. They were watching someone who'd proven herself under the worst circumstances imaginable. Marcus Webb stood at the back of the group, his posture different than it had been 6 weeks ago. The arrogance was still there. That was part of who he was, but it was tempered now with genuine respect. When Elena finished the demonstration, he was the first to ask a question. Dr. Vasquez, in the field, how did you manage the psychological pressure of making life or death decisions that quickly? Elena paused, considering the question seriously. You accept that you can't control everything. You train until the technical aspects are automatic, so your mind is free to focus on judgment. And you build a team you trust absolutely, because no one does this alone. She looked around at the faces watching her. That's true in combat medicine, and it's true here. We save lives together. Down the hall in her small office, photos and notes covered one wall. Harold Chen, the valve replacement patient from that first dramatic day, had sent a picture of himself with his 3 grandchildren, all of them wearing matching surgical masks as a joke. His recovery had been perfect, and he'd written to thank her for not giving up when his heart had crashed. The soldiers from the mass casualty incident had all survived. 2 had already been discharged. The others were in various stages of recovery, and several had stopped by to thank the surgical team personally. And Colonel Rodriguez, fully recovered, had become an unofficial ambassador for the veteran transition program Elena had developed. He'd spoken at 2 medical conferences already, advocating for recognition of military medical training in civilian contexts. Pat O'Connor appeared in the doorway, carrying 2 cups of coffee. Thought you could use this. The senior nurse had become Elena's closest ally, the bridge between military and civilian medical culture that made the transition program work. Thanks. Elena accepted the cup gratefully. How's our newest recruit doing? Captain Sarah Martinez? Pat smiled. She's adapting well. Little overwhelmed by how much time we have for each patient compared to field hospitals. But she's brilliant in trauma. Started her 2nd week as a 2nd-year resident yesterday. That's 7 veterans now in the program. Elena looked at the organizational chart on her wall, each name representing a military medical professional who'd been given a genuine pathway into civilian medicine. 7 people who might have struggled to find their place, now thriving. 8, actually. Pat corrected. Got another application this morning. Navy corpsman, specialized in battlefield triage, wants to transition to emergency medicine. Elena made a note. Set up an interview, and make sure he knows about the PTSD support groups. Transition is about more than just medical skills. Her phone buzzed with a message from Dr. Brennan. Board meeting in 20 minutes. Budget approval for program expansion. She'd presented the proposal 2 weeks ago. Expand the veteran medical transition program. Establish formal partnerships with 3 other hospitals. Create a certification pathway that would be recognized nationally. The statistics supported it. Trauma survival rates at Metropolitan had improved 23% since implementing combat-derived protocols. 7 veterans had successfully transitioned into residency programs. The model was working. The board meeting was efficient and positive. The expansion was approved with full funding. Elena would direct the program while completing her own residency, a dual role that would have been impossible if she hadn't already proven her capabilities so dramatically. By the time she returned to her office, it was nearly 5 p.m. She had 30 minutes before evening rounds, time she usually spent reviewing cases or updating program documentation. Instead, she found herself standing at the window, looking out over the Chicago skyline as early winter darkness settled in. Her phone buzzed again. A text from Marcus. Need consult on complex cardiac case. Your expertise requested. 6 weeks ago, he'd laughed at her suturing technique. Now he sought her expertise on difficult cases. The transformation wasn't just hers. It was systemic. Another message. This one from Jennifer Park. Veteran Transition Program featured in Journal of Trauma Surgery. They want to interview you. Elena smiled slightly. The program was gaining recognition beyond Metropolitan Medical Center. Other hospitals were reaching out, asking how to implement similar initiatives. The Department of Defense Medical Corps had contacted her about designing a national curriculum for military to civilian surgical transition. The scope of impact was growing exponentially. What had started as one surgeon trying to hide from her past had become a movement to honor and utilize the expertise of military medical professionals nationwide. A soft knock on her doorframe made her turn. Dr. Brennan stood there, his expression thoughtful. Thought you'd want to know. He entered, closing the door behind him. Department of Defense called. They want you to direct their national transition program. Full-time position, significant funding, chance to implement this across every major medical center in the country. Elena absorbed this. That would mean leaving the residency program. You've already completed more surgical procedures than most attendings. Brennan sat in the chair across from her desk. The residency is a formality at this point, but the choice is yours. You can finish here, become an attending at Metropolitan, continue the program on a smaller scale, or you can take this national, change the entire system. It wasn't really a choice. Elena had learned, through pain and loss and hard-won wisdom, that some responsibilities couldn't be ignored. There were hundreds, maybe thousands of military medical professionals struggling to transition to civilian practice, carrying guilt like she had, undervalued and underutilized. She had the knowledge and platform to help them. When would they need an answer? End of the week. Brennan studied her face. For what it's worth, I think you should take it. What you've built here in 6 weeks is remarkable. Imagine what you could do with real resources and national scope. Elena looked at the photos on her wall. The patients saved. The veterans helped. The protocols implemented. This was just the beginning. I'll take it. The words came easily, feeling right in a way few decisions in her life had. But I want to maintain a connection here. Guest lectures, consultation on complex cases, continued collaboration with the program. Done. Brennan stood, extending his hand. It's been an honor working with you, Major Vasquez. This hospital is better because you were here. After he left, Elena sat in the quiet office as darkness fell completely outside. In 6 months, she'd gone from hiding her identity to embracing it fully, from trying to forget her military experience to using it to help others, from carrying guilt for deaths she couldn't prevent to saving lives she was uniquely qualified to save. Her pager went off. Trauma alert. All available surgical staff. Elena grabbed her white coat and headed for the emergency department, her stride confident and purposeful. There would always be another emergency, another patient who needed exactly the skills she possessed. And now, thanks to the program she'd built, there would be others like her. Veterans who'd served in impossible circumstances, learned under fire, and brought those hard-won skills home. The ED doors opened, and she stepped into controlled chaos. A patient on a gurney, nurses moving efficiently, residents responding to commands. This was where she belonged, not hiding from her past, but integrating it into her present, not pretending to be someone she wasn't, but being exactly who years of training and experience had made her. Dr. Vasquez. The trauma attending called out, "We need you here." Elena's story shows us that our past doesn't define us unless we let it. Across the country, countless veterans struggle to find their place after service, carrying skills and trauma that few understand. Their journeys toward healing and purpose are waiting to be shared. If this story resonated with you, there are many more tales of courage, redemption, and the extraordinary capabilities of everyday heroes. Join the Emergency Heroes Stories family by subscribing and ringing the notification bell. Share your thoughts in the comments below. Your support helps us bring these important stories to light. Until the next tale, thank you for being here with us.